I'm Swapnil Hiremath. I'm a nephrologist from the University of Ottawa in Canada. We have a very special guest today, Carolyn Thomas from Vancouver. Carolyn, can you tell us a little bit about yourself and your patient journey?
Yes. Hello. I'm a heart patient. I had a heart attack in 2008, subsequently diagnosed with coronary microvascular disease. After that, I got 2 for the price of 1.
And you do a blog, which is Heart Sisters.
Yes.
And that's where she has written very passionately about this topic. And I would like you to expand on compliance. We used to talk about patients taking their medications and they're not complying with the doctor's orders to take their medication. And it has softened a bit to be called adherence.
Compliance is a term that for many patients is cringeworthy because it sounds like it's a patronizing word dating back from the good old days when patients followed doctor's orders. Now we have patients who don't do that. What we know is that every patient has a reason for not taking medications. In our case today, high blood pressure medication. Every patient has a reason. Doctors may not like that reason. My guess is that most doctors aren't even aware what that reason is. Your cholesterol's too high, your blood pressure's too high, your A1C number's too high. We have to get that down. So patients tend not to focus on numbers. They tend to focus on how they're feeling. Or there's a long list of reasons, again, many of which are unknown to doctors. I have readers in my blog who have told me that they have canceled their doctor's appointment because they know that their numbers are not going to be good. Cost of medications is a real issue for some patients. And yet I'm a heart patient who takes blood pressure medications and have done for many years. And not one doctor has ever asked me, are you still taking your blood pressure medication?
How can we do a better job?
That's the question, isn't it? Dr. Lisa Rosenbaum, she's a cardiologist out of Boston. She did a study on this very subject. Why are patients not taking the meds that we prescribe for them? And she had an interesting quote. I wanted to believe that if patients knew what I know, they would take their meds. But what I've learned is that if I felt what they feel, I'd understand why they don't. So my suggestion would be to see how we can phrase that, to reframe the benefit so that the patients can see it. How does it affect my body? Not how will it get my numbers down so that decades from now, I might be in better health. One issue that's often brought up among patients is trust. If I have a long-standing relationship, I am more likely to trust this person. My trust in a person who I know is much higher. And sometimes we don't have that luxury. You may see this person in emergency, or you may see him because it's a specialist that your GP has referred you to. So maintaining that trust, even in the first few minutes, not talking about your symptoms, not talking about your drugs, not talking about your low numbers that we're going to fix today, but finding out if you have grandchildren, where do you live? Where did you grow up? It's that little small connections that will make people say, this person is interested in me.